This is Neil Osterweil. Dr. Sadbi Omer from Emory University in Atlanta and colleagues have been studying both parent and healthcare provider attitudes toward the efficacy and safety of childhood vaccines. They found that recent medical school graduates are about 15% more likely to question vaccine efficacy than older physicians. Younger doctors were also more likely to say that immunizations do more harm than good, and less likely than their older counterparts to express confidence in the safety of both inactivated and oral polio vaccines and measles, mumps, rubella, and varicella vaccines.
So there are two things that we found. The first thing is that the overall support for vaccines was high across the board in physicians, irrespective of their age. But then when you looked at relative support, when you looked at whether there were differences within these groups, we found that the physicians who graduated more recently had lower perceptions of vaccines efficacy for almost across the board, and then had lower perceptions of vaccine safety for at least some of the vaccines. So this is one of the questions that emerges from the study, one of the future research questions, and is to ask what are the vaccine specific experiences individuals are getting during their medical training. And that would be a focus of at least our group going forward, to not only look at whether there are gaps, but also more importantly, what are some of the areas of intervention where you could intervene in terms of increasing, in terms of highlighting the importance of vaccine to all physicians who are undergoing training.
The findings suggest that medical schools may need to beef up training regarding vaccine-preventable diseases.
We expected to see differences more in terms of vaccine safety, because that's then vaccine efficacy, perceptions regarding vaccine efficacy. And because that has been the pattern in parents. So I think what we think is happening is that since everyone expects that there will be concerns about vaccine safety in the overall community, not just the physicians, the messages are going out regarding safety. And so they have been picked up by a lot of physicians of different age strata. But efficacy is something that's not highlighted as much as part of those messages. So maybe we need to highlight both efficacy and safety in communications messages.